The topic I am presenting today pertains to the importance of electronic health records and their use in the behavioral health profession. Currently, the use in the behavioral health profession is limited due to concerns about security of sensitive information. The limited use has resulted in lack of shared information necessary for reporting purposes in research and inhibiting an inter-exchange of information between providers, patients, and their families. This presentation will review contributive factors as well as review the importance of data security to protect sensitive information with regards to substance abuse and mental health. In 2009, the HITECH Act provided provisions under the guidelines established by the American Recovery and Reinvestment Act. The Act provided incentives to providers who implemented the use of electronic health records and facilitated inter-exchanges of information to enhance efficacies, standards of care, quality, and access. As a result, the use of electronic health records improved communication between providers and patients, increased patient satisfaction, improved efficiencies of practices, facilitated improved coding, and improved standards of quality. Additionally, it facilitated improved inter-exchanges of information between providers, third-party payers, patients, and researchers. Subsequently, it resulted in improved continuum of care measures and outcomes. Many factors contribute to the low implementation rate of EHRs in the behavioral health setting. Inclusive are concerns over security, concerns over cost, and low compensation rate for behavioral health professionals. Meaningful use under the direction of the Department of Health and Human Services provided incentives to providers for implementation of electronic health records, increasing data reporting, standards, and access. Although meaningful use provided benefits and autonomy in the health profession, currently it is set to expire. Processes are in place for development of secure behavioral health software that incorporate enhanced security such as encryption of key data elements and domains. Additionally, various work groups under the direction of the Office of the National Coordinator for Health Information Technology are working towards development of secure information exchanges. Concurrently, the implementation of health information exchanges promote the exchange of information, provider-to-provider communication, provider-to-patient communication via messaging, and it also enhances health measurements and outcomes. Comparatively, due to the low implementation of EHR use, the data collected may be misconstrued due to miscoding and lack of documentation. The Office of the National Coordinator implements policies and guidelines related to health information exchange. One of the workgroup initiatives implemented is the Behavioral Health Data Exchange Pilot Program, currently being analyzed and tested for secure interstate exchanges of sensitive information with success and is close to the go-live phase. Conjunctively, the National Coordinator's Office has developed a roadmap of initiatives leading up to 2025 which will promote interoperability, the use of electronic health records in the behavioral health profession, secure exchange of information, facilitation of research and public health measures, enhancement of efficacies, and health information exchanges. Additionally, it will result in a learning environment as it will enhance exchanges of information. Consequently, as a result of increased awareness of the need for increased implementation of electronic health records, a bill has been introduced in the Senate named S-1732, the Improvement of Behavioral Health Technology Act, and it is currently under review in the Senate Finance Committee. The main objective of this piece of legislation is to provide incentives for the use of electronic health records in behavioral health to facilitate increased standards of care and quality. Increased use of electronic health records will result in enhanced data exchanges and give patients and families the opportunity to maintain personal health records within the health information exchanges. It will also allow them to have access to a world of information pertaining to new advancements in research, as well as granting them autonomy.